Hello, this is Lee, licensed acupuncture and herbalist. I like to talk about dry eyes. What's the reason causing dry eyes and how we can prevent that with our lifestyle changes, acupressure and acupuncture. Dry eyes becomes very common even for the younger generation. And the reason we have dry eyes because our tear gland function are not as good as when we were 20 years old. So the common reason causing dry eyes are like aging, menopause, or andropause. When your hormones going down, all your functions of the gland, including tear gland, become weaker. Also, certain kind of autoimmune disease, for instance, Sjogren's, it's also influence the glands in your eyes. So the other common reason is when we have laser surgery. After the laser surgery, usually the tear gland function is not as good as before. And I have been treating many patients with this condition after laser surgery. Also, when people have high eye pressure, we're trying to give the ophthalmologist give them eye drop to lower the eye pressure in order to protect the optic nerves. But this also can reduce the fluids around your eyes. So that dry eyes is pretty bad, can lead to blurry vision and also infection. Another common reason is dehydration. You don't drink enough water, then you are going to have dry eyes because you don't have sufficient blood flow. Also, the electronics, iPhones, if you're staring at a computer for over 2 hours and every day, or using your phones, your eyes will not blink as normal as they should. And then the tear gland function also diminishing just because the muscle around eyes are so tight, the blood vessel constricting, you don't have sufficient blood flow to your eyes, to your tear gland, then they won't function normally. Then how acupuncture and acupressure can help you to relieve these dry eye problems? First, when you have higher stress, it will influence your tear gland function. The tear gland produce thinner fluids and also thicker fluids. The thicker tears are secreted more when you are under stress. So if you are constantly under chronic stress, then you won't have the right amount of thin tears and thick tears to protect your eyeball. So the eyes will become dry because the thicker tears can make the eyes feel drier. Also, the tear film should be formed in certain speed. So if the tear film is broken up too fast, then you lose the fluids covering your eyeball, and so you can feel dry. And the other thing is just simply you don't have sufficient blood flow to your eyes because the low blood pressure, because the dehydration, because your eye muscle getting too tight. All of this acupuncture can help instantaneously. So once we insert needles at a certain point, then I can see or you can feel the tears come up. But how to maintain this moisturized condition, it depends on how you're going to protect your eyes. So recently there is 2 studies using acupuncture, combining the eye drop to see how acupuncture and eye drop to help relieve this dry eye condition. So in one group, we only use acupuncture. We use acupuncture and eye drops. And on the other group, we only use eye drops. And the dry eye condition was improved by 76.9% in the combining group. Comparing the only eye drop group, it's 53.8 percentage. So there is a significant changes when you combine acupuncture and eye drops. And another interesting study saying that the manipulation on the points, acupuncture points, also plays important roles. So in this study, Chinese researchers recruited 110 patients, and one group called observation group, they use a strong stimulation. So when they push down the needles, they use strong power and a large amplitude. So they push hard and deeper. The other group, they just use a very light stimulation, very light rotation and putting up stimulation. So that light stimulation we call a control group, comparing the strong manipulation. And then the points they use is also acupressure points. I had a video before, if you search acupressure dry eyes, and it's like the bladder 2 and the Yiming, and also there's a back shoe point for the liver, spleen, and the kidney. And the important thing is they treat people 3 times a week for 3 months, and then they will test the eyesight, and they find the eyesight was improved by 83% in a strong manipulation group versus the gentle manipulation, the effective rate only 63%. So you will see these big differences between different kind of manipulation. And there's also structural changes. Comparing these two groups, the strong manipulation and the gentle manipulation, the macular nerve layer, fiber layer, and the retinal neuroepithelial layer, the different layers in the retina area, the swelling and the thickness are significantly reduced in the observation group, just because the observation group with a stronger manipulation can reduce the inflammation much more effective than the control group. So with this point, bladder 2 at the end of your eyebrow, if you can press that, or other point I showed in another video, you press that every day before you go to bed or before you get up. I think before you go to bed is more important because your eyes are strained for the whole day, and you need to bring the blood flow to nourish your eyeball. Just simply go to sleep. It's not going to sufficiently relax your muscle, improve the circulation. So if you can do this acupressure point here, there, or behind the ear every day for 10-15 minutes, you will save a lot of money to see an ophthalmologist, and you will save your eyesight, and you still can see without glasses maybe until 80 or 90. If you need more information, you can go to BostonChineseAcupuncture.org. Thank you.